Okay, so good afternoon and good morning. We're going to go ahead and get started. So good morning to those of you on the West Coast and good afternoon to those of you on the East Coast. Welcome to the final session in the series. As a recap for those of you who have missed prior session, in this series we have been focusing on a wide range of topics relating to energy production and the processes relating to energy extraction and development, including fracking and unconventional oil and natural gas development, and what these processes might mean for reproductive and developmental health. We have heard from a lot of different speakers and have heard about everything from the broad impacts of fossil fuels and climate change on children's development to the importance of community participation in environmental health research, science, regulation, and policymaking. Today, we will be closing our session with a final look at what needs to be happening. What do we need to be doing to be moving towards a cleaner energy future? What strategies and goals are necessary for regulatory development at both the local and federal level? And what needs to be done for us to be able to link the reproductive health research to policy? How do we need to be advancing the science, professional training, the public education, and the health policies to be able to reduce the impacts of environmental contaminants from energy production on reproductive and developmental health? So I'm going to go ahead now and introduce our first speaker. We are honored to have with us today Katherine Phillips. Katherine Phillips is the director of Sierra Club California, and in that role leads legislative and regulatory advocacy and overall administration of Sierra Club California. As director, she oversees coverage of nearly every environmental issue that crosses the state capitol and in key agencies. This includes energy, transportation, wildlife, forestry, water, climate disruption, and air quality. She previously directed transportation and air pollution work in California for Environmental Defense Fund, where she worked on regional, state, and federal policy, and also gained experience in agriculture policy and water policy. Before joining EDF, Katherine was a senior policy advisor at the Center for Energy Efficiency and Renewable Technologies, where she focused on air quality and transportation issues. Katherine holds a bachelor's in history from the University of California, Berkeley, a master's in journalism from the University of Missouri, Columbia, and a master's of public policy degree with a dual focus on natural resources and transportation from the University of California, Los Angeles. A former journalist, she is the author of 2 books about environmental issues. Katherine today will be speaking about regulatory advocacy and efforts in California at the state and local level around unconventional oil and natural gas development. So welcome, Katherine, so much for joining us today. I'm going to let you begin in just a moment.
Thank you, Ellen. And thanks everybody who's taking time out of the first day of what I'm sure will be for most people a very busy week to listen to this. I'm going to be talking about specifically about California. So this is a case study for you to see what's happening in one state that has a national reputation for being on the cutting edge in a lot of ways on environmental and public health regulation. But in this case, certainly on oil and gas regulation, isn't doing as much as many of us believe should be done. So let me give you a few basics about fracking and what we call well stimulation in California. Fracking and well stimulation, and I'm just going to use as I go forward now just the term fracking, is used mostly for oil extraction in California. In other places, fracking is used for natural gas extraction. Here we refer to it as extreme oil extraction methods, and fracking would include, just as a reminder, it includes mixing very harsh chemicals with propellant, which is usually some kind of sand, and water, and pumping that under high pressure underground, very deep underground, and it forces breakup of rock and other materials so that oil that is otherwise hard to get at or natural gas in other parts of the country is hard to get at, is accessible. And well stimulation is a similar process, although it's usually different chemicals. It can include steam, and it often doesn't include a propellant. But in California, fracking and well stimulation are, with the exception of what's called cyclic stimulation, fracking and well stimulation are regulated together. The terminology well stimulation applies to fracking. So I'll probably use those interchangeably, and just let me know if you're getting confused. There are about 84,000 oil wells in California. About 3,000 of those use fracking and these extreme extraction, what we call extreme extraction methods. And that's probably a low estimate. We're relying on a fairly recent information to get at how much extreme extraction is used in California. For many, many years, it wasn't tracked, and because of some legislation that was passed a couple of years ago, there is more reporting required, so we're getting a better handle on how much extreme extraction is occurring. About 200 million barrels of oil are produced annually in California, and extreme extraction accounts for about 20% of that. The interesting thing here is that this number, about 20%, comes from a recent report that I'll talk about towards the end of the slideshow. But this recent report has been the closest we've had to a fair estimate of how much extreme extraction is actually used. The Brown administration has been saying for at least a couple of years, they've been saying that about 30% of the state's oil comes from extreme extraction, and in fact they've been inflating how important extreme extraction is to oil production. Some of the oil production, oil wells, occur in urban Los Angeles city and county. There are people who literally, there will be a backyard, and then beyond that will be an oil well in urban areas in Los Angeles. But most of the oil drilling occurs in the southern San Joaquin Valley. That's Kern County. And here's a map of California on the left side of your screen. Kern County is down here. The San Joaquin Valley is this part of California here is called the Great Central Valley. And if you split it in half at about Sacramento, half of it is the Sacramento Valley and half of it is the San Joaquin Valley, slightly more. And so at the bottom of the San Joaquin Valley is Kern County. And this is where oil drilling really began in California. But there is still a substantial amount of oil drilling occurring in Los Angeles. And you'll see these little dark brown or red spots. That's where any oil drilling is occurring. Some of those wells are active or are inactive. So of that roughly 84,000 wells in the state, maybe about 25,000 are considered inactive, which means they're not actually operating, but they're still there. The wells are still there. Here, just for informational purposes, I've posted a map. Both of these maps are by this great group called Frac Tracker Alliance. This is one in Los Angeles of active oil and gas wells where they tend to occur. It's the red dots, and then where you see the triangles, that's where acidizing is occurring, and that's where you use pretty high concentrations of hydrofluoric acid, usually mixed with water, to not just break up the ground beneath, but to actually melt it. And then you'll see that there's quite a bit of acidizing in places that are very heavily populated. So what do people think about fracking in this state? When we think about how should the state be responding, to fracking. You know, public health folks, environmentalists, we tend, people who get paid to do environmental policy like me, our instinct is that fracking is not a good thing to do in this state for a variety of reasons. It has been found to be polluting water. It has the injection wells as a result have been found to be polluting water. It creates air pollution. It makes us more dependent on oil. There's a whole realm of reasons, but it isn't enough just for people who spend all their life paying attention to environmental issues to care about it. We have to make sure the public cares. So a number of polling and studies have been done, and I just post some of the numbers up here. We've seen that between July of 2013, when we really started paying attention to fracking in California, and it started making news, because until probably about 2012, nobody was in the environmental community was really thinking about fracking. We were so involved in other issues, and the fracking issue was really an issue that was occurring in big oil and gas fields in other parts of the country, we thought. Well, then some very smart environmental advocates started looking into it, found out that it actually occurs here in California too, and started bringing it to the public's attention. So what we found that by July of 2013 in the Public Policy Institute of California's poll, which is done annually, they found that 51% of adult Californians oppose fracking. That was fairly quickly after it was discovered it was being done here. And I think that was pushed in part by Gasland and Gasland 2 that helped inform people about what fracking is. And then in July of 2014, we did, the Public Policy Institute again did its annual poll of environmental issues and attitudes, and it had bumped up a slight bit. Last year in May, a year ago, we, the Sierra Club, and a number of other organizations were sponsoring a fracking moratorium bill. So we did some polling, had FM3, a polling firm, do some polling about what public attitudes would be about fracking moratorium bill, and we found that more than 2/3 of people supported a fracking moratorium bill. So the public is with us. In California, the regulators are divided between the state level and the local level, the entities that are responsible for regulating fracking and other oil and gas activity. The lead at the state level is the Division of Oil, Gas, and Geothermal Resources. That's called DOGGR. The other sort of supporting cast would be the State Water Resources Control Board and the Air Resources Board. The State Water Resources Control Board is responsible statewide for protecting water quality, and the Air Resources Board is responsible for protecting air quality from stationary sources, or from mobile sources, but also for establishing standards for stationary sources. At the local level, we have local air districts that are, there's about 35 local air districts. Some of them include more than one county. And they are responsible for basically enforcing those standards that are set by the Air Resources Board on stationary sources. And then the local water boards also, there are regional water quality control boards. They also are responsible for ensuring that those state standards are enforced. So the Division of Oil, Gas, and Geothermal Resources, DOGGR, is generally thought of as being sort of a classic case for a political scientist to delve into if a political scientist was looking for a captured regulatory entity. This has been for many years essentially the domain of the oil and gas industry, and it has been run as a permitting agency, not as an agency that is established to protect public health or protect the environment or ensure that oil and gas and geothermal activity is done in a way that is consistent with other state goals regarding water, air quality, and climate change. At the decider level, policymakers, at the state level, there's the state legislature, of course, and then the governor. And in California, we have a Senate and an assembly. And then at the local level, there's a county board of supervisors, city councils, and voters who have all been weighing in different ways on fracking. So let me talk about the legislative action first, the one that is most significant and that probably is best known within but also outside of California, and that's Senate Bill 4. That bill was passed in 2013, and it essentially is a bill that's trying to encourage and advance transparency. So it requires DOGGR to develop a permitting system for fracking and well stimulation, specifically for fracking and well stimulation, and it requires the agency to prepare this programmatic environmental impact report that looks at existing fracking wells. And then the bill also directs the Air Board, DOGGR, the Water Board to pay more attention to data collection and monitoring. So so again, it's mostly about transparency, mostly about data collection, mostly about monitoring. And it also, though, directs the Natural Resources Agency to do a study on the impacts of fracking and well stimulation, which was originally scheduled to come out in January, but it became clear after it took several months to just line up an independent scientific group to study the fracking and well stimulation that they needed more time. So now that study is going to be completed in July. The first part of the study has come out that establishes how much fracking and well stimulation is occurring in California. That's why we know, for instance, that there are about 3,000 wells, but that's also why we know that there are about 20% of California's oil production is associated with extreme extraction. Last year and the year before, the environmental community, with a growing coalition of allies that included some business folks, the recreational industry, some solar folks, included certain labor unions, tribal interests, environmental justice, environmentalists, public health, Nurses Association, and so forth. We tried to pass legislation that would impose a moratorium. We tried it once on a smaller scale in 2013, and that bill didn't get very far. And then we tried it again last year. And last year we got through multiple committees and got to the floor, and it failed by 3 votes. And those were votes that, basically 3 senators, Democratic senators, stayed off the bill, so that it effectively was a no vote. And so we failed to get the number of votes we needed to pass. And the oil industry spent an incredible amount of money last year on fighting various and sundry bills. One of those was the moratorium bill. The oil industry is among the largest spenders over at the legislature. Right now, there's another bill going through. So of this year, the environmental community and the folks who are concerned about fracking have reduced our ambition over at the legislature. And this year, one of the bills that we are proposing and supporting, it would essentially redefine DOGGR. And that would make it a more active, proactive regulatory agency and less of a passive permitting agency. That bill has gotten through committee and is going to be on the floor in the first house soon. It's a Senate bill. I know it's going to be an uphill battle. There has also been a lot of activity to beef up other regulations that are existing and through legislation this year. And there's an injection well regulatory bill moving through the legislature right now, and an open pit regulatory bill moving through. There has been, because of SB4 that I mentioned earlier, and growing concern about fracking, there has been a broader effort to look at all the steps that occur in oil production. And the result has been that we have discovered that there are a lot of open pits that have not been permitted that contain waste from fracking sites and other kinds of oil production waste. These open pits, some of them, if you stand next to them, you get a very acidic, sort of acrid odor. Injection wells, there was a recent revelation that regulators had been aware of, but the general public hadn't been aware of, that for many years, the Division of Oil, Gas, and Geothermal Resources, DOGGR, has been allowing the injection of oil industry waste into injection wells that go straight into groundwater pools or aquifers that are regarded as protected and likely to be used, or of a quality that could be used for drinking water, until, of course, you inject pollution into them. There were, the revelation has been that 2,500 of these wells these injection wells have been allowed by DOGGR in the state. Recently, DOGGR closed somewhere in the neighborhood of 23 of those 2,500, and then reopened one or two of those, but at least a dozen and a half have been identified as polluting or threatening to pollute drinking water. There has been some local action by residents that includes ballot measures. Some of you may have heard about the ballot measures in November. Santa Barbara County had a fracking ban. That ballot measure that was initiated by citizens, that one failed. The oil industry spent about $6 million to kill that one. And then San Benito County, which is the lead town in San Benito County, the largest town would be Hollister. That county did pass a fracking ban. Both of those counties are significantly different. Santa Barbara has a large and sprawling population. San Benito is relatively rural, smaller population, required a smaller number of people to vote. And while it was a pretty aggressive mano-a-mano campaign, and the oil industry pumped a lot of money into trying to fight San Benito County, the organizers were extraordinarily organized, and they managed to beat back the effort to kill that ban. So Santa Barbara's failed, but San Benito's passed. Recently there was another fracking ban in a small community called La Habra Heights in Los Angeles County, and that one failed. It was a pretty small county and small city, and quite a bit of money was poured in by the oil industry. Local ordinances and resolutions, about 15 city or county resolutions, including a few ordinances, have passed that would ban or support bans or encourage a moratorium on fracking and well stimulation. The most recent is a Butte County ordinance that bans the importation or disposal of fracking waste in Butte County. Right now there isn't oil exploration going on in Butte County, but it's a very rural county with a strong farming community that is very concerned about the potential influx of oil and gas development that could have harm on the water supplies there. So it's a relatively conservative county, but there is an interesting coalition of local environmental people and agricultural folks and some very conservative agricultural folks who've been looking for ways to make sure Butte County, which is north of Sacramento, doesn't suffer. So there have been some legal challenges in the past and one in the future. One of the notable ones in the past is that in 2013 there was a multi-organization, a coalition that challenged environmental review practices of Dogger. Dogger had essentially not been doing environmental review of any of the fracking well sites in the San Joaquin Valley, and that was challenged. Unfortunately, as part of getting SB4 out in the negotiations to allow that bill out, the governor inserted into SB4 a condition that essentially made it impossible for our lawsuit to go forward, and established a programmatic environmental review and said that had to be completed. And the oil industry then went to the court and said the lawsuit by the multi-organizations, including the Sierra Club, was no longer allowed, and the court agreed. And then in 2015, last week, there's been a new challenge by the Sierra Club and the Center for Biological Diversity to Dogger regarding the underground injection wells. And Dogger has, despite all the press, despite everything that all the concern raised by the legislature, is continuing to allow injection of oil waste into those 2,500, roughly 2,500 injection wells to continue. And we have challenged them and filed a suit to require them to shut down those injection wells. That again was just filed last week, so that will be something worth watching. So what's on the horizon? The programmatic EIR, that means that the Dogger is looking at all of the fracking sites and well stimulation sites they've allowed in California to date, and figuring out where there might be some in the future and what are the characteristics that they need to meet, what are the qualities or standards they need to meet. The draft of the programmatic EIR has come out. It's not as strong as we would like, and in a couple of months the final will likely come out. There will be some new data, new monitoring recommendations coming from the State Water Board within the next 2 months, 2 to 3 months. We anticipate that there will likely be additional lawsuits. There are some local entities of citizens looking at ways to pass additional bans and resolutions challenging fracking. And then there will be the release of the scientific study that's required by SB4 in July of 2015. So thank you. And here's my contact information.
Great. Thank you, Katherine. Thank you so much for that. It was really troubling, but also I think very important and interesting information for people to learn more about the current situation in California. So I know that attendees probably have a number of questions, so you can go ahead and type those into the chat function in the GoToWebinar control panel, and we'll be sure to get to those questions at the end of the next session. So I'm going to go ahead now and introduce our next speaker. One second here. Okay, so we're pleased to have with us Dr. Rachel Morello-Frosch. Dr. Morello-Frosch is the professor at the University of California, Berkeley School of Public Health and the Department of Environmental Science, Policy, and Management. Her research examines race and class determinants of environmental health among diverse communities in the United States, with a focus on social inequality, psychosocial stress, and how these factors interact with environmental chemical exposures to produce environmental health inequalities. Much of her work has examined this environmental justice question in the context of ambient air pollution, indoor chemical exposures, prenatal exposures, and effects on birth outcomes and children's health, often using community-based participatory research methods for data collection. As part of this work, she also explores the scientific and bioethical challenges of exposure assessment and chemical biomonitoring in marginalized communities. In collaboration with researchers and regulatory scientists, she has worked to develop scientifically valid and transparent tools for assessing the cumulative impacts of chemical and non-chemical stressors to improve regulatory decision-making and to advance environmental justice goals. So Dr. Morello-Frosch, thank you so much for joining us today, and welcome. Just give me 1 second here and I'm going to make you the presenter and you can begin.
Okay, can everybody hear me? I'm assuming you can. Thanks, Ellen. So today I wanted to shift gears a little bit and talk about some issues related to reproductive health and chemical exposures more generally, and how policy action on some of these issues can perhaps provide some lessons for policy strategies and community-engaged science to address the health impacts of energy development. So as many of you know already, chemical production in the United States has increased now more than 15-fold, basically since the end of World War II. And many of these chemicals, overwhelming majority of these chemicals are actually registered for commercial use without adequate testing. And just to give you a sense of how many pounds of chemicals we're talking about, that's about 30 pounds of chemicals per person in the United States in terms of how much is produced compared to our population. And not surprisingly then, we see that people are exposed in a myriad of contexts where they live, through water, through consumer products, and in the different microenvironments in which we function every day, where we live, work, play, commute, etc. And there's certain communities that are more highly impacted by different kinds of exposures, including energy production, but also occupationally, etc., than others. And this has implications particularly for reproductive health for both women and men. The focus of my discussion today is on female reproductive health. But and increasingly, science is in providing some very compelling evidence about the impacts of prenatal exposures to environmental chemicals. These impacts initially, when people were looking at this from a scientific point of view, were focused on immediate birth outcomes, so small for gestational age, premature births, low birth weight, birth defects. But increasingly what we're seeing is that many of these prenatal chemical exposures and also exposures to psychosocial stressors such as malnutrition, material deprivation, and poverty not only have impacts immediately in the perinatal period after the baby is born, but can have health impacts throughout the life course in terms of long-term risk to chronic diseases. And so also in terms of reproductive and developmental health outcomes. And increasingly, there's been more scientific work to better characterize exposures of women to chemicals during the prenatal period. And so several years ago, the President's Cancer Panel produced a very compelling report looking at environmental links to cancer. And when this report came out, it was quite a milestone because prior to the issuance of this report, there had been a hesitancy on the part of the report's authors to really give credibility to the links of chemicals to cancer risk over time. And they particularly lifted up the question and the issue of prenatal exposures to chemicals with this quote that says, "To a disturbing extent, babies are born pre-polluted." And subsequently, there was an excellent report that was released in 2012 by the World Health Organization and the UN Environment Program by a series of scientists who specialize in endocrine disrupting chemicals and their potential health effects, documenting the state of the science and what we know about exposures to endocrine disrupting compounds which disrupt our hormonal systems and potential links to diseases and disorders that appear to be on the rise globally, particularly in industrialized countries. And it said very forcefully that, in fact, many of these hormonal-related diseases are on the rise, and that evidence is strongly suggestive, although it's still somewhat equivocal, that chemicals may be an important link to trying to understand why we're seeing a rise in many of these developmental disorders that are related to hormones. And so what I'm talking about here are things like prematurity, preterm birth, babies born small for gestational age, babies born with low birth weight, reductions in fertility, longer time it takes for women to get pregnant, overall global decreases in testosterone levels and sperm counts, increases in certain kinds of reproductive cancers. For example, testicular cancer in young men is definitely on the rise. And the last one is the decreasing average age of puberty for both boys and girls. So I know that the focus of this webinar series has been on energy production, and yet we still have very little data, as Katherine explained earlier, on what the potential health effects, let alone what the potential exposures are to people who live near these operations, these gas extraction operations. And so studies are starting to emerge, like this one, that's looking at links between natural gas development and reproductive effects. This one particularly looked at the association between the number of wells within a 10-mile radius of where mothers lived while they were pregnant. And what they saw was a twofold increased risk of neurotube defects among women who were in the highest tertile of exposure. In other words, they lived in the places with the largest concentration of gas wells within their vicinity, and also a statistically significant increase in risk of congenital heart defects in this group. And so this study adjusted for a lot of things that might explain increased risk in these types of birth defects. And there are a lot of caveats to the study. For example, just looking at proximity to the actual operations, and it's not able to really tell us what it is about these operations or the kinds of exposures that women are experiencing. But this is, we have a pretty serious paucity of good data to really characterize exposures that people are experiencing, which is why a lot of policy strategies are aimed at trying to require more data collection in terms of exposure and localized impact, so we can better get a handle on what the potential health effects are of this kind of energy development. So it's important to think about context, if we're thinking about the impacts of energy development and potential exposures through air contamination or water contamination. It's important in terms of reproductive health to realize that women are already exposed to multiple chemicals, industrial chemicals, and there's been some really good studies, including by my collaborators at the Program on Reproductive Health and the Environment, that found using the Centers for Disease Control, which does a biomonitoring study of a representative sample of the U.S. population every few years. And so This study looked at women of childbearing age and pregnant women in particular, and found that on average, 43 industrial chemicals were found in every pregnant woman in the United States in these samples. And so we're not talking about, just a clean slate and then looking at the isolated effects of energy production. We have to think about this in the context that people are already exposed to ubiquitous chemicals, and energy development could just be another additional and major source for people who are affected by the air quality and water impacts of energy development. So one of the things I wanted to highlight is policy lessons that can be learned from efforts to address chemicals in consumer products, and in this case, the impacts of flame retardants in pregnant women and people's exposures, and the ways that you can see some pretty immediate benefits of policy strategies once they are implemented. So as some of you may already know, flame retardants are ubiquitously used in consumer products. In California, they're used in, until recently, were used in furniture foam as well as electronics products, ostensibly to reduce the risk of household fires. And what happens is these are very bioaccumulative chemicals, and they love body fat, and so these chemicals tend to find their way into house dust, and we're exposed to them through that way. And so research has shown, as you can see in this graph, that in samples taken of pregnant women in California, levels of a category of flame retardant known as polybrominated diphenyl ethers, or PBDEs, and these are different congeners, 47, 99, 153, and then a sum of all of these together. In the purple bar is pregnant women have the highest levels worldwide so far. Much of this has to do with the fact, this is also looking at levels in comparison to other dust levels in homes. Okay, so if we look at this next graph, if you see the bars in the dark orange, the highest levels of household dust found in people's homes tends to occur in low-income communities of color, again, in California. And so what's unique about California is that we had until recently a unique furniture flammability standard that required basically furniture manufacturers, in order to meet this performance standard, they basically were compelled to add a lot of chemicals into their furniture foam in order to come into compliance. And so this has had the unintended impact of leading to a situation where Californians tend to have the highest levels of flame retardants out of anyone in the world, in low-income communities in particular, in part because furniture foam tends to deteriorate, furniture tends to be more worn out in these low-income homes, and so higher exposures are likely to occur. So environmental health advocates, again, have really pushed us to think about the ways in which we're not exposed to one chemical at a time or chemicals from one source at a time. We really need to think about linkages between social inequality and the fact that people are exposed to multiple hazards in different environments, and that certain communities are going to be more vulnerable to the toxic effects of chemical exposures due to poverty, malnutrition, and underlying chronic health conditions. And this leads to what I like to call triple jeopardy, where you can see that disparities in chemical exposures can occur because certain groups are disproportionately working in hazardous occupations, live in places with the worst air quality, water contamination. Then we have what I call extrinsic or social vulnerability factors that are socially driven: poverty, food insecurity, less healthcare access, etc. And then biological or intrinsic susceptibility factors due to age, underlying chronic health conditions, sex, etc. All of these factors can combine to create interactive or additive effects that drive health disparities, and why we see persistent disparities in chronic diseases that fall along racial or class and economic lines. And so what does this mean for chemicals policy? Well, one is that we do have some good frameworks in order to improve chemicals policy. So the pharmaceutical industry, for example, in order to put a new product on the market, has to demonstrate that data is that the product is safe or is likely to be, its benefits are much more likely to outweigh its potentially problematic side effects, okay? And that's not the case for chemicals. Chemicals are put on the market, often with inadequate testing, and are considered basically safe until proven otherwise. And so to give you a sense of how chemicals policy operates under a notion of toxic ignorance, it's literally baked into our regulatory system. So as shown by this graph, if you look at the 6,700 chemicals that are manufactured or imported into the United States at 25,000 pounds or higher, only about 200 of these chemicals, if you look at this blue bar, have actually been tested for any health effect at all, okay? So you have about 6,500 chemicals, these very, very, very high production volume chemicals that have not at all been tested, and yet they're still out there in the environment and being used, and we're exposed to them. And so we're in a situation where our regulatory process assumes that no data on these chemicals means no problem. And there's a great analogy to be made in terms of energy development as well. While, you know, we have the proliferation of natural gas extraction operations in a situation where there's been no really systematic effort to assess what its potential health impacts, and the underlying assumption of that regulatory framework is that no data means that there's no problem, when in fact it really just means no data. So in terms of chemicals policy, oftentimes with enough kind of consumer concern, sometimes industries will reformulate products and substitute things, which can be good. So we've had the phase out of polybrominated diphenyl ethers, which is a good thing, but very often the substitute can be just as problematic or worse than the chemical that was phased out. So we call this the whack-a-mole approach. You know, again, where a lot of the new compounds that are coming to use are not adequately tested. And so the public really sort of bears the burden to show harm, and pregnant women in many ways are the poster child guinea pigs for our problematic chemicals policy. However, I think it's important to say that, you know, once we get policies in place, and in California, we did eventually ban this category of flame retardants, PBDEs, in late 2006. And within a very short period of time, as you can see from this graph, you can see a very precipitous decline of about 65% in PBDE levels in pregnant women. And so you can really just see how this impact really can lead to pretty dramatic effects in a relatively short period of time. And the wonderful aspect of this is that it really looks at just exposure assessment. We can document this over a short period of time. We don't have to do long-term epidemiological studies to show the effectiveness of policy. So we were fortunate in that, you know, Governor Brown, after numerous attempts, again, just Katherine's stories about attempts to get a moratorium and do all these things, and the impact of industry in sort of beating that back in many places, even though there have been some victories. The same thing has happened in terms of the efforts to ban flame retardants. Numerous efforts in Sacramento to do this ban, a lot of efforts by the chemical industry to beat it back. Finally, we got an executive order from the governor, who I think was, you know, a very successful coalition finally convinced him that this needed to be fixed. And then the other thing that we work toward in terms of lining our ducks for policy change is to really get major players on the scene to come out and make very public statements about the impacts of chemicals on health and the need for policy change. And so one major report that came out very recently was a joint report by the American College of Obstetricians and Gynecologists, as well as the American Society of Reproductive Medicine, issued a joint opinion saying basically that the evidence that links exposures to chemicals and adverse reproductive developmental outcomes is compelling enough that policy needs to move forward to reduce exposures in the broad population. This was released in Washington, D.C. It was great fanfare. People of both of these societies met with staffers in Congress, and this report continues to be leveraged in an attempt to really try and move forward chemicals policy reform in D.C., which again, there's a long road to hoe, even though if you look at sort of the public statements by U.S. EPA, environmental health advocates like Safer Chemicals, Healthy Families, and even the American Chemistry Council, everyone sort of publicly agrees that chemicals policy needs to be modernized. But the devil's always in the details in terms of how the language of those bills pan out, and not surprisingly, Congress is not exactly a perfect environment to sort of move these things forward right now, although people are definitely working on a bill and trying to move this forward. So while things on the federal front may look difficult and challenging, I want to also reiterate that in terms of implications for moving the conversation on energy development and disseminating knowledge to try and leverage policy change, I think, health studies take a long time to get definitive information, and even it requires a proliferation of studies, which can take a long time. And we need to, be able to move policy now. And so I think exposure assessment and the encouragement of getting more data on the exposure impacts of energy production is one way to get there. And I think community engaged strategies to do that can help in this regard. So I want to give an example of a form of community engaged science that folks in Richmond, California have really tried very hard, worked very hard with scientists like myself to do. As many of you know, the Chevron refinery is in a very populous location in Richmond, California. It's the largest oil refinery west of the Mississippi, and is over 100 years old. And there's a lot of concern about its impacts, including major fire events like these ones that you see here on the slide. So we worked with environmental health and justice advocates in Richmond who really wanted to get a sense of what is the impact of the refining operations on fence line communities. And so we did a household exposure study, monitoring air inside homes, as well as collecting dust samples. So you can see people vacuuming the fan, and we went in and vacuumed people's homes, collected this information. And what we were trying to do is assess whether pollutant profiles, and we compared Richmond homes to homes in Bolinas, California, which is a gorgeous place in Marin with no major industrial sources nearby. And we were able to show that vanadium, which is key sources from petroleum refining, has a pretty significant impact on both outdoor air, shown in blue in Richmond, yellow is Bolinas, as well as indoor air in people's homes. And so this was the first documentation that nearby refining operations was impacting the indoor air of people's homes. And then we looked at this relationship between nickel and vanadium levels in Richmond, which is here on your left, and to a similar city in Houston, Texas, both of which host major refining operations. And this kind of profile really indicates that the pollution is really due to refining activities, where you don't see that same kind of profile in an area of Los Angeles where there aren't refining activities. So again, this kind of exposure assessment data can really sort of pinpoint what the localized impacts, at least on air quality in this instance, is of a particular operation. As a result of that study, we were able to leverage from the refinery, from Chevron, resources to do fence line monitoring at the refining site. This data is made available on real-time online to the public. We're trying to make it sort of more digestible and visually appealing to diverse stakeholders, but at least that data now is being collected in 6 locations, including along the fence line. So again, I think that form of data judo has helped kind of make data more transparent, more available, the kind of thing that we need to inform policymaking. And so I just want to end by saying that community-engaged science, especially in the realm of exposure assessment, can be a way to try and advance the policy conversation. And when we do these kind of community-engaged work, it can improve the rigor of our science by getting better data, ground truthing that data with community help, making sure we're asking the right questions, and always thinking about opportunities and ways in which people can reduce their exposures either through policy change or also individually, and then ultimately figure out how we're going to leverage the knowledge that we get from these kinds of community engaged science projects to drive policy change. And I'm just going to end there. Thank you.
Great. Thank you so much, Dr. Morello-Frosch. That was a really informative and really interesting presentation, so thank you for that so much. So we're going to now open up the session for questions coming in. There's some questions that are coming in. So I'm going to go ahead and start to ask some questions. And attendees, just so you know, you can continue to enter in your questions in the GoToWebinar control panel, and we'll get to as many of those as we can. And whatever questions we can't get to during this session, we'll be sure to follow up after, get those questions answered. So the first question is going to be for you, Katherine, and the question is, how would you say the oil and gas situation has been affected by the drought going on in California?
Well, the interesting thing is it hasn't been affected by the drought. And many of us had hoped when a recent emergency drought measure was put into place, order was put into place by the governor, that certain industrial uses of water that make the water unusable forever and into the future would have been among those uses that would have been required to cut back. In fact, the governor has required an average of a 25% cutback in water use in urban areas. Some areas it goes up to above 30%, in some areas it's less, but on average 25%. For agriculture, agriculture has had to have quite a bit of its water cut back because of the systems through which agriculture gets its water. The federal system and the state water project have both cut back the amount of water that agriculture has available to it. But the oil industry has not had any, with the exception perhaps of landscaping at their urban headquarters, the oil industry has not had any requirements to cut back its water use. In California, on average, a fracking activity, one fracking well, uses about 140,000 gallons of water. Now, some people say that's not that much. That's, you know, maybe golf courses use more than that in a year. But the golf course typically doesn't take the water, fill it with any of 750 pollutants and propants and other toxics that can't be stripped from that water. Typically a golf course or an agricultural operation, they don't pollute the water and then send it back into the aquifer, which is apparently what's happening now with the oil industry. So every time a frac job is done and about 140,000 gallons of water is totally polluted, that water can never return to the system in a positive way. It can't be used again on agriculture. Now, the oil industry has been arguing that they can clean up this water and sell it to agriculture to use on land, but last week or the week before, the Los Angeles Times had a story about this so-called reusable frac water or oil industry water, and there are problems arising about the quality of the water and what it's doing to the land. So I don't think that is going to be or should have been a realistic use for this water. They shouldn't be using that water on products that people are going to eat. So there really isn't right now any controls over water use by the oil industry.
Great, thank you. This next question is for Dr. Morello-Frosch. The question is, as someone familiar with both policy and research, what would you propose as next steps for investigating the possibility of a link between reproductive health and energy production?
Well, I think you know, there's a paucity of good studies in California, and I think, for example, more work could be done to leverage the Dogger data that Katherine was showing to look at potential reproductive health outcomes. I'm actually trying to see if we can get some resources to be able to do that, because California has some very outstanding kind of birth registry where we could look at similar questions that have been looked in, that are starting to be examined in other places where there's natural gas extraction. So I think that's kind of a useful place to start. And then I think, again, thinking creatively about how to engage with communities to also do some air quality monitoring, water quality monitoring, to better capture, what might be going on, and then especially for compounds that we already know are problematic for health. I think just producing that exposure information can also be quite compelling in terms of leveraging that kind of data to pressure policymakers for action. Anything to sort of diminish that perennial no data, no problem situation that we find ourselves in the fact, and to pressure again the industry to be more forthcoming and to provide resources for monitoring in similar ways where that the refining industry has had to been compelled to do over a similar period of time.
Thank you. This next question is for you, Katherine. What advocacy approaches would you say, from your perspective and your work, have been helpful? Would you say messages, organizing approaches? What would you say have worked well with getting through to legislators and agencies?
Well, we are going up against one of the largest, if not the largest, industry worldwide, and an industry that is willing to spend lots of money to influence policy outcomes. And so it's essentially, deep, endless pockets. And given that, our belief has been that you have to use absolutely every strategy available. And at different times, different strategies seem to have worked. And by those strategies, I mean there have been some grassroots groups that have bird-dogged the governor, for instance, gone to his events where he's going to be showing up, and as he's going in or out, standing there, the protesters will be standing there with the press in view, holding signs saying, "Climate heroes don't frack," or that sort of thing. That's actually been effective, and we keep hearing from people within the administration that the governor doesn't like that. It makes him feel very uncomfortable. Other strategies have been using the press, making sure the word gets out. Some groups have spent a lot of time doing valuable studies of their own. NRDC did a very good study that looked at oil and gas wells generally in the state and who and how it's impacting people, but especially where they are and who it's impacting. And they found that about 1.8 million Californians live within a mile of an oil well, and that the people who are exposed or living that close to oil wells or closer are disproportionately low income, disproportionately people of color. So doing those reports, getting press for those. We've had some great help from really wonderful legislators who have carried legislation. Some of it has gotten passed, some of it hasn't, but have carried legislation, and in the process of carrying legislation have been able to focus attention on some of the bad aspects. And that also involves having public hearings, informational hearings at the legislature. But then, everything politics is local. So part of the strategy that has worked in some places is making sure that local city councils, local boards of supervisors, local town planning committees, local neighborhood associations all are aware and are in position to pass resolutions and pass ordinances. So we call this sort of the fire ants at the picnic strategy that is coming at the oil industry from all places so that they never feel that they have won the fracking battle in the state and have managed to discourage people from putting any more resources into it. I have to tell you, I've worked in environmental policy for about just short of 15 years, and I've never seen anything that has been so motivated or so driven by the grassroots. This is not something that people who think about environmental policy all the time have gone out and said to the public, you know, we really need to worry about this. This is something that people at the grassroots have said, we're not going to take it anymore, and they've gone to their local city councils and they've organized their neighbors. And I think that is ultimately going to be the most effective in that it does trickle up.
Thank you. Dr. Morello-Frosch, do you believe, given your research, that we should be concerned with air pollution from energy production and perinatal outcomes? And if so, what measures would you suggest that women take to protect themselves and their families?
Well, there's been some systematic reviews looking at the effects particularly of ozone and particulate matter on birth outcomes. And it definitely indicates that, at least for birth weight, the higher levels of particulate matter are related to the risk of having a lower birth weight baby, and ozone also has adverse effects. And we're concerned about particulates also, you know, not only because of the oil drilling itself or gas extraction, but also because of all the traffic moves in and out of there to bring in and take out all the materials required to run these operations. Now the work that has been done on ozone and particulate matter has been basically looking at ambient air quality generally. Again, data on actual ambient air quality that is specific to gas extraction is still lacking. So, you know, ideally to do kind of more targeted monitoring in places where you have these operations nearby would probably enable one to better characterize what the actual ambient air quality levels are from gas extraction as well as other sources in those locations. Other strategies are, you know, there's been some efforts to model ambient air quality based on what you know, the kinds of emission sources are there. So those are the kinds of measures you could use, and then take advantage of geocoded births to see what to look at any potential relationships between air pollution associated with gas extraction and poor birth outcomes.
Thank you. Katherine, there's another question here from you. The question is, given your advocacy work on unconventional oil and natural gas development, what would you say in your conversations and things that you've been hearing from legislators and agencies, what would you say are the biggest impediments that they've been reporting could be overcome with either more specific science, data, or key messages from health professionals?
You know, on an issue like this, just as with the formaldehyde battle that Rachel was mentioning earlier, a lot of times it's a matter of trying to overcome the very well-financed power of an industry. And that can only happen if the message is very, very clear and there is no ambivalence as the scientist is presenting the information. So for instance, in the case of fracking, being able to very clearly link oil fracking in California to the health and environmental outcomes that we believe are occurring, and to be able to state it in a way that is not that is very clear and not sometimes scientists have a way of saying, we think this is going on, but we need more research. And then you finally get to the point where you say, yes, cigarettes cause cancer. When you get to the point where you can say cigarettes cause cancer, that's when you can overcome the moneyed interests. So I think one of the things we need to do or what would be helpful for researchers to do is to figure out where can we say, yes, this is causing that, or where do they feel comfortable saying very clearly, this is a problem, and if we want to be cautious and not have a negative impact on public health or a negative impact on the environment, we need to stop this now. The greater the clarity, the stronger the message from the scientific community, the more likely it is to be able to help beat back the influence of the funding from the industry.
Thank you. And Katherine, there's another question here, and that is, how does what is going on in California fit with California's greenhouse gas reduction goals?
Well, it doesn't fit at all. That's the problem. When the protesters carry those signs saying "Climate heroes don't frack," I mean, it's kind of amusing, but the fact, as a slogan, but the fact is, if we are going to reduce the impacts of climate change to a level that will become survivable, we need to keep the energy that is in the ground in the ground. And some of these, especially in California, some of the promise of fracking is that it will get to sources of carbon fuels, which produce greenhouse gas emissions. It will get to sources that were once thought inaccessible. So if we go in and start taking these inaccessible sources out, and in the process ruining the water and polluting the air and risking public health, if we go in and take those carbon-based fuels out that were once inaccessible, we are making it impossible for us to contain the worst impacts of climate change. So there is no consistency between allowing fracking and meeting or achieving greenhouse gas reduction goals. One of the things the governor has said, and he has said this to me myself, so I know he says this, is that, well, the answer lies in reducing demand. We'll focus our attention on reducing demand. That means, getting more electric cars out there, getting more transit, doing what we can to make ourselves less dependent on oil as a transportation fuel. That's a good thing. Nobody wants to stop reducing demand, but that doesn't mean the oil won't be extracted and sent to other states, other countries. The oil industry has no motivation as long as oil prices are high, and right now they're kind of low, so that's kind of a good thing for us. But the oil industry has no motivation to stop producing oil unless they are told they cannot produce oil in a particular place using particular methods that take oil that was inaccessible and contribute it to the whole global warming catastrophe.
Thank you. Dr. Morello-Frosch, there's a question here. From your perspective in your work, what would you say needs to be done to begin to address the problem of environmental justice and energy production issues?
Well, I think, well, a couple things. I just wanted to add something to what Katherine said before I answer this other question, which is one of the other compelling aspects of hydraulic fracturing is that the assumption is that it is a clean source of energy, natural gas, and the reality is that research also indicates that it increases leakage of methane, which is a very potent climate-forcing gas, much more so than carbon dioxide. And so the notion that it has less of a climate change impact in terms of a source of energy is actually being disputed in terms of the impacts of its extraction process itself directly on climate change. In terms of what can be addressed around the environmental justice impacts of climate changes, you know, I think California has been an epicenter of environmental justice advocacy for a while, and I think that is has to do with our demographic makeup, which has really shifted the environmental conversation. Polling data indicates that communities of color, in particular in California and also nationally, are more concerned about climate change than their white counterparts as a proportion of their own populations. And so I think that it's key in terms of organizing and advocacy to realize that low-income communities of color, even though I think traditionally the assumption has been that they don't have the luxury to worry about long-term issues like climate change because they're more concerned about bread and butter issues like putting food on the table. These constituencies, and particularly in poor communities in the Central Valley that are being directly impacted by energy extraction activities, are key constituencies that can be mobilized and put pressure on politicians to really change their views on this fracking issue and to start voting differently. And I think that is a key source that we just need to work hard and tap to in terms of organizing over the long term. Communities of color turned out in droves when there were efforts by the oil industry to overturn California's climate change law, and that was really key to stopping that from happening. So I think, you know, while I'm a scientist and I think I emphasize the importance of scientific data to make policy change, science alone never wins the day. And so the key is really towards mobilizing new constituencies and doing more alliance building to lift up the importance of this energy extraction issue for environmental justice communities throughout the state.
Thank you. We have another question here, Katherine. The question is, the report expected in July 2015, do you think that that will support the California position to put in for a moratorium?
Well, they've released their first chapter, and then there are two more chapters, those addressing health and then case studies, health and the environment, and then a case study. So two more chapters will come out in July. I'm anticipating that given all that we know so far, there will be, and the fact that that the scientists who are collecting the data are fully aware of what we know about injecting into aquifers and that sort of thing. And what the recent science is on impacts of some of the chemicals that can get into the water system. I suspect that there will be enough evidence in that study to justify or to support a moratorium. But as with all studies, it will likely be a long document. There will be people who will be reading it in different ways. And there are questions that they are asked to address through the legislation. And then there are other questions they aren't asked to address. So if they stick to the legislation, there may be still more questions that are out there. So, I think part of the issue will be not so much does the study support a moratorium on fracking? Because I do think it will. I think the issue will be, will the people who are in power, like the governor, will they take the opportunity of this report to justify what many of us have been saying is the right thing to do in the first place, and that is to impose a moratorium until we can be certain that Californians are protected, both their health and their environment, from the impacts of these kinds of technologies. Frankly, I think once a moratorium is imposed, I doubt it would be lifted. I don't think the oil industry would ever have or be willing to spend the amount of money that would be required to keep these technologies or make these technologies safe enough.
Thank you. Okay, so there's just a couple more questions here because we're coming to the end of the session. Both of these questions are really for either of you, both of you. So the question here, one question is it true that a number of the chemicals used in energy production are either grandfathered in under TSCA or are exempted from regulation through the Halliburton loophole? So which one of you would be comfortable answering that question?
I think Rachel's probably better on this one.
Yeah, a lot of the chemicals that are used in fracking, at least based on the studies that I've read, are grandfathered in under TSCA. In terms of the Halliburton loophole, I'm less of an expert on that, but maybe Katherine can answer that question.
I am not an expert on the Halliburton loophole, so I probably can't. Sorry about that.
So for the person that asked that question, we'll try to get you some more information after the session. All right, thank you to you both. There's one last question here, and I think maybe both of you can answer it in different ways. So I'll start with Katherine. For those of us working on unconventional oil and gas issues, from a health perspective, what would you as a policy advocate recommend for us to be doing, or in general for people to be doing, to be more effective in helping you in your work?
You know, in California, if you're in California, you need to sit down and do something that's really old-fashioned, and that is write a letter to your state assembly member and your state senator that speaks from the heart about your concern about fracking and the oil industry activity. And then send copies of those letters to the governor. And it's interesting because when you look at what legislators respond to, and when people have studied what do legislators respond to, the thing they respond to most remains a handwritten letter. Alternatively, or in addition to that, if there are any opportunities to meet your legislator in district, that is, if there's a town hall meeting being held, make sure you go and you raise this concern about fracking and the oil industry and the oil industry's impacts on public health and the environment. Then joining groups like the Sierra Club or Credo Action or Food and Water Watch or Center for Biological Diversity, there's a whole list of them, NRDC, joining any of those groups and getting on their action alert listserv so that when actions are asked for, sending a letter to the governor, talking to your local city council member, then that would be really important. And then finally, again, all politics is local. If you have a relationship with somebody on the city council, if you know you're the member of your city council, be sure you reach out to that person. And even if you don't know them, reach out to that person or that office, either with a letter or a phone call, asking them to consider drafting and introducing an ordinance or a resolution. You're going to have to sort of be the judge of the politics in your local community that would call for a moratorium or a ban on fracking in your community.
Thank you for that. And Rachel, the same question for you. For those of us working on these issues from a health perspective, I know that you're not directly working on energy issues, but as a scientist, from a scientist perspective, what would you be recommending those of us that are in this field to be doing to make the work more effective for scientists who are working in this field?
Well, I think, in addition to all the great stuff that Katherine just listed, one of the other powerful things that can be done is to get major scientific and public health societies to take a position on this issue. Some are starting to do that, but, it's sort of the example we gave around the American College of Obstetricians and Gynecologists and the Society for Reproductive Medicine making that statement about the impacts of prenatal chemical exposures, and then really sort of placing that in Congress to just say this notable, scientific body is saying that you have to do something about this, I think can also hold a lot of sway. And so that's another kind of point of entry in terms of organizing and advocacy, is to, when you have opportunities and entrees, to work with those with scientific associations and societies to educate them on the issue and to work with them to see if they'll take a public position, and to maybe even play a role in advocacy either in Sacramento or the federal level or wherever it makes sense.
Great, thank you. So we're going to go ahead and wrap up now because we're at the end here, but I want to thank everyone for their questions. Center for Environmental Health and Reproductive Health Technologies Project would like to extend our sincere gratitude and appreciation to our speakers today for participating in this. I know I've learned a lot, and I know we've been getting really, really wonderful feedback coming in. People have been really enjoying and learning a lot during this series. So thank you again to both of you. And thank you also, extend our appreciation to prior participants and speakers who have been speaking. We want to take a moment also just to let people know that we will be administering a final survey, so we'll be sending that out. So for those of you participating, please fill that out so that we can continue to improve our work, and be on the lookout for a future series, because I'm sure we'll do some on some new topics. We'll do some additional topics. So if people have ideas or thoughts about things that they would like to learn more about, please feel welcome to reach out to me or other people at CEH or RHTP. So thank you again. It's been really inspiring to hear about the work. So thank you both, Katherine and Rachel. We'll close out now. So thank you guys. Take care and have a wonderful day, everyone. Bye.